Okay, we are here for the February 9th, 2026 Board of Health meeting for the town of Fairfield. I'll turn it over to the chairman.
Thank you. Good evening, everyone. It's 7:31 p.m. on the 9th, and we'll call the meeting to order. And we'll start with approving the last month's meeting minutes.
Motion to approve.
I have a motion. Is there a second?
I'll second.
Who was that?
Sophia.
Okay.
Great. Any opposed? All right. Hearing none, the minutes carry. And we'll move into our report. So, Sam,
okay.
The floor is yours.
Sure. So I'll do just a quick look at how we're doing in terms of viral diseases. You can see here, all of them tend to be trending in a downward direction. I am pulling up their DPH respiratory viral dashboard with, last month we talked about maybe it wasn't declining quite yet. It might have been a delay factor, the CDC was saying, but it seems pretty clear that influenza cases are coming down. RSV cases are starting to trend down, and COVID-19 cases are trending down as well. I think like the wastewater surveillance is showing very low levels of COVID-19, and that's matched and mirrored by this upper line here, which is hospitalizations due to COVID.
Sam, can they track the wastewater for anything else, flu, RSV?
Yeah.
Are they doing that?
We're going to talk about that. Yeah.
Okay.
I mean, I'm not sure of all the parameters they're doing for wastewater, but, right now they're, what they're putting on this is the COVID on the dashboard here. Well, this is vaccination, but, they do, and it just depends on what program is sort of funding it. So CDC funds some things, and the state funds some other things. So we're trying to, so yes, there is more things being looked at. I don't know the full scope of it, but in this one, there's just putting. Hi, we have a new member.
Oh, hi, it's Sally Connolly.
Hi, Sally. You're here with Tracy, Jason, Mark, Sophia. And I think Henry said he was going to call in, but I don't hear him yet. So we're just kind of doing the report here. The vaccination rates, you can see, the numbers are continuing to come down. We've got the highest rates in those, let me pull this over here. Those 70 and older with, 39 and 80 and older, 41%. And that is, let me pull this down, matched with what's going on with positive tests at the federal level, are trending downward now. Hopeful signs that, the worst of it is moving beyond us, with measles cases. That is not declining at this point. It continues on a national level to have measles cases. We're up to 733 cases. I'm going to pull up this chart here. So in 2006 to date, we have 733 cases versus last year it was 2,276 cases. So we are, we're 1 month into it, and we're already, almost a third of the way there. You'll see that most of the cases this year are in those under the age of 19. About 95% of those are unvaccinated. Those cases with so far about 3% of them being hospitalized. So we've had no additional cases in Connecticut aside from the one case in December, which was travel associated. Though they did announce today on the CDC website that the wastewater surveillance for measles did pick up a a positive hit for measles in the wastewater in, they didn't announce where it was, but it's from the map. It's in western part of Fairfield County, close to the New York line. There's and it doesn't necessarily mean there's a resident there, but there was someone present in that area that had it. So and that was, I think I brought it up. That was from the period January 25th to January 31st was when that hit happened.
That's like an incredibly sensitive test, right? I mean, you've got to assume there's not a whole cluster of people, right? So, I mean, that had to come from probably one person. So the fact that it picked it up, like, that's impressive.
It's hard to be sure. It doesn't necessarily mean one case. And one of the recent studies done by the CDC showed that that cases in the recent past have shown up about 10 weeks after you get a hit from a wastewater surveillance. And so, the range was like 6 to 10 weeks, but they're saying, the average was around 10 weeks, I should say it that way. So we're kind of on alert now. So it's reviewing, there's a CDC has a, toolkit for local and state health departments to be ready. So it's kind of to refresh on that, although we did that last in December, so it's not too old at this point. But that is, concerning to have that, but it doesn't necessarily mean a Connecticut resident. It could be somebody traveling through on I-95 or visiting Stamford or Greenwich or somewhere in the area. February is Heart Month, and so we've rolled out a series of activities related to Heart Month, one of which is we're having our Know Your Numbers campaign. So every Wednesday this month, we are doing Know Your Numbers and having an additional one for town employees. And so we have one of them is almost full. And towards the end of this month already with appointment. It's an appointment-based program. And then we did the Wear Red last Friday. I see you're doing it still, Jason, right? So, we did get some social media pictures posted of the staff here wearing red. I was at a meeting in Stratford for the Health Improvement Alliance, and we did our own picture there in red and posted it on social media. So you'll see both of those on our social media. And in addition, the town of Fairfield initiated a statewide hands-only CPR challenge. And so we created a survey with the videos embedded, a training video for hands-only CPR from the American Heart Association in multiple languages. So you basically watch that video and then tell us what town you're from, And so right now we're up to, I should have checked the numbers, but at like 5 o'clock today, we are at like 380 people have viewed the video, and it's something like 240 of those are first-time viewers, 136 people viewing it as a refresher, and that's across 80 different towns so far in Connecticut. So we forget, closing in on 400 people, and so we're happy that the Connecticut Department of Public Health picked up on it and posted it on their social media, so that gave us a boost. But we'll continue to do it this whole month, and we don't have a target number, but we're hopeful that, hey, in 1 week we got 400, so let's hope we can get, maybe 1,000, but we'll see. So it's this collaborative thing with all the health departments and health districts throughout the state are posting it and putting it up on their social media, and so we're trying to get as many people as who can to learn this, for Heart Month, to learn this basic life-saving skill. And so we'll continue to work on that, and hopefully next month we'll have a big number to update you with. So some of the regional activities we've done lately is we had what's called, it's appropriate with what Jason and I were just talking about, the weather and how cold it is, that we had a regional tabletop called Arctic Blast, and it was a, extreme cold scenario presented with various different types of failures going on throughout the communities. And basically there was about just under 150 people or so at this tabletop at Fairfield University, coordinated by the regional emergency planning team, specifically Michelle DeLuca from Norwalk was did most of the effort behind it and getting it to happen. And so it in a format similar to other regional tabletops, each town would have their own table, and would be for Fairfield, we had folks from the health department, folks from social services, folks from emergency management, fire department there, fire chief was there. We just kind of talked through different scenarios of what would happen and how would services be provided and how would we meet the needs of the community. And then they would present different scenarios and then do report outs on how, different questions for each town in different rounds, and and how the town would respond to that. And so these are always great to sort of talk through the scenarios and think about it. Especially, right now I just signed an order. I think I have another one tomorrow. An order for no heat. With furnaces going down and pipes freezing. We had a pipe freeze water leak at an establishment today that we had to close down. And so there's all sorts of things going on that are related to extreme cold for long periods of time. So anyway, it was a good tabletop exercise. We continue to, social media-wise, focus on Heart Month, promoting the activities and various topics throughout the month, but also promoting, cold weather tips, extreme cold, educational material, and how to stay healthy during the winter. Next month, Santina, Dr. Duranko submitted for a presentation to the Connecticut Public Health Association annual meeting, and she was accepted to present, and she'll be doing that next month, where she is focusing on, and I think you probably recall, we had our immunization grant with a media campaign, and so she's presenting on sort of the collaborative effort we did with, I think there was 7 health departments got together to pool their funding and hired a public relations team, and developed a website, developed a marketing campaign that was put out, and we've gotten multi-millions of views on that material. I think I've shared that before. So she's kind of presenting on that collaboration effort, and even most recently, the state used our website that we developed from that, and Get Vaccinated CT, as the in one of their social media posts, saying, hey, it's like there was a peak a little while back of I forget which one, but it's still time to get it, find your vaccinations here, and they used our website rather than a state website, So it was interesting. So for public health nursing, we're currently hosting 5 Sacred Heart University students who are being precepted by elementary school nurses for their public health rotation. So Sarah is working on that with the nurses, and she reports that we are, right now, public health nursing is fully staffed, and they've been able to add even more sub-nurses to meet the demand, which is always good. The change in the rate of pay for in the recent, collective bargaining agreement and prior to that, has helped with retention, and it's helped, especially in recruiting new subs, because we were losing them to other towns that were paying more. And Sarah Payne, our nursing supervisor, has accepted a position with a board position with the Association of School Nurses of Connecticut, and she will be the head of the technology. She'll be the technology chair on that, which she reports her very savvy tech-savvy children are very amused that she's the tech chair for her association. No doubt they will be called into service to help her, I'm sure. Environmental health, we're still working on two sort of, legally complicated cases of one overcrowding, one infestation. We're hopefully close to the end of these. But we continue to work with the town attorney assigned to this to try and resolve these issues. But I think on at least one we think is done, and they're currently renovating some renovations, and we're going to inspect after the renovations. And then the other one, is an overcrowding issue with college students up in the Sacred Heart area, and we are trying to work with the owner to reduce it, but we're not getting the collaboration we expected from them. So we will be moving forward with the next legal step in that. And I am very happy to report that, so I sit on the board of condemnation, and we oversee blight and unfit structures, those two ordinances. And so two of the most, long-standing properties on the Board of Condemnation agenda under blight this past week, both have been demolished. So, we had put fines on the property, and the fines had accrued, significant fines had accrued, and the property owner of both, it's one property owner of both properties, through their attorney, negotiated with the town on a fine reduction in lieu, with the condition of demolishing the houses. And so the Board of Selectmen agreed to that, and that started a 60-day window to demolish them, and then they are both down and on the ground, and properties are being cleaned up as we speak. So well within the 60-day period, but it's two of the properties that we've been on the agenda a long time, on and off for decades. And so it's finally resolved, and we'll still be collecting, more than $100,000 in fines related to these two properties. So they're not getting away without a significant fine, but it was reduced to encourage the demolition of the properties. We did have a case of a child with an elevated blood lead level. We did order testing and remediation if necessary. The tests came back positive, and we recently received and approved the abatement plan, and so we're working with the owner now to roll that out. The cold weather is impacting that as well. So this owner's hoping to move once there's a little break in the weather to get, to have a fair amount of it is outside work, and so they're trying to get that done. But the owner has done some interim control measures inside the house to prevent, any further exposure to those surfaces that tested positive. And then we continue to work with purchasing now to secure a strategic plan consultant. The previous consultant that we had used to do it, I spoke with him this past week, and he said, I'm finally retired now from doing this. So we have to go with a new consultant, but hopefully we'll move forward with that and have a new strategic plan in place this spring. And then we go before the Board of Selectmen later this month to present our departmental budget. We're still waiting to hear regarding the new position. Spoke with the finance, one of the budget coordinators, and they said we'll find out before this meeting of whether they're going to move forward with that position or that is going to, not pass the first round. So I did want to. I think I covered this. look at this. I did want to, just for some good news, so I'm pulling up a chart for those on the phone of Fairfield resident deaths, the age-adjusted mortality rates for the town of Fairfield. And so I am not going to spend a lot of time on it, but I just thought I would share some, positive news in terms of some of the broad categories. So if you go down to diseases of the heart, it's sort of a combination category. This column here is 10 years ago, is 2008 to 2012. This is the results for 2018 to 2022. This is part of our prep for strategic planning. And so you can see here the age-adjusted mortality rate has gone down significantly from 301 per 100,000 to 254 for diseases of the heart. Chronic lower respiratory diseases deaths has gone down from 49 to 36 per 100,000. And I wanted to show Mark one that he'll appreciate. Nephritis related. That's you, right? Down from 51 to 34, so the 10-year difference showing a decline in the rates.
Mark's doing a great job there.
Yeah, we credit that to Mark.
We didn't see there's also one for end-stage renal disease.
There is one, yeah, end-stage renal disease. Unfortunately, that one did slightly go up.
I'm not surprised.
Yeah.
People are living longer for other reasons.
But then, and I don't know if you understand the differences here. There's a different category of end-stage renal disease, CDI indicator related, which shows a decline from 51 per 100,000 to 38.
So is that, when it says related, is that like a secondary cause then? Like, say, primarily died of like an MI, but they also had, end-stage renal disease that contributed kind of thing?
I'm not, it has something to do with the categories that they include. So here they list all the different indicator categories that are included in that number, which this one shows an increase, but here it's again, it's just a different set of indicators showing a decrease.
It's hard because there's a small group of patients who are on dialysis who decide that they don't want to continue, but most of the time, most of the deaths are usually related to one of the other cardiac, or infection related.
Sure.
Because
so
it's hard to know what the primary cause is, but those numbers are.
But some of the
encouraging.
there's some encouraging numbers here. Diabetes.
One DKA, that's incredible. I'm shocked.
What's that?
One DKA death, that's incredible.
Yeah.
Diabetic ketoacidosis.
Yeah.
I'm shocked that's all it is.
And diabetes-related deaths has gone down from 40 per 100,000 to 28 per 100,000. If you look at all cancers, malignant neoplasms, we've gone down from 135 deaths per 100,000 to 121. And, infectious diseases has also come down nearly by, almost by half.
Any striking increases that caught your eye? I mean, a lot of these are going down, which is great. But
So the ones that caught my attention here is
Parkinson's, cirrhosis or traumas or something,
Alzheimer's disease and related dementias went up, 53 to 63 per 100,000. Parkinson's went up slightly. The other one that is accidents and unintentional injuries slightly went up. Falls went slightly up. The suicide went slightly down. Not a lot, but slightly down. So some of those are, and again, it's stuff we're working on. With our Matter of Balance program, we're trying to prevent falls among seniors, and so we're working on that. Injuries, they had a broad category of all injuries went up slightly, and poisonings. That was the one that surprised me. It went up from 6 per 100,000 to 14 per 100,000.
Doesn't surprise me at all.
No.
So,
What's your-
what counts as poisoning? I mean, do we see a lot of, like younger people now, like kids, that are getting into the edibles, the cannabis edibles?
Yeah.
We've seen a huge uptick in that time frame there since legalization happened.
I mean, and are you seeing, but you're seeing increase in deaths related to that, or just increase in
Actually,
cases?
good question. Yeah, good point. No, not just cases, but you
Yeah.
got to assume there's probably some increase in deaths in some
Yeah.
cases. Not
Yeah,
much
so-
cannabis, but I mean.
So, yeah, that was the one that kind of, I saw that, and that one kind of surprised me, I hadn't seen anything on that, but, so it's, there's a lot of positives, if you look at, this chart, if I go over to, I'm scrolling over to different towns now, if we pull up, I'm gonna show you Bridgeport, and you'll see the yellow is levels going up, and so they have, a fair amount of levels, they have some going down, but they have some that are going up, and they.
Wow, that went up, the poisonings went up
Yeah.
incredibly.
The more arrows, the more significant, the increase. And so they're seeing a lot of injury increases compared to us. And if we go, go over to Connecticut, overall, you'll see similar things that Connecticut is seeing. While they are seeing lots of decreases, they are seeing a fair amount of increases there of different rates going up, Alzheimer's going up a little bit more, related dementias. So it's promising for us that we're not seeing we didn't see any significant, was categorized here as significant increases. Some increases that, is important to take note of. But, from a comparison and a rate perspective, we're doing well in comparison to some of the neighboring towns in the state as a whole.
I do wonder, looking at the ones that have gone up here in Fairfield, when we look, a lot of those are really age-related issues. And so I have to wonder if our overall life expectancy in Fairfield itself is increasing some, which is correlating to that. Yeah. Probably not.
I did look at,
data yet.
well, the median age in Fairfield has gone up, over the last, I think it was 5 years, the last data I saw, has gone up. But these are age-adjusted rates, so that they're accounting for differences in the ages of different populations. So, like, for example, Florida is a very old state, so there's a lot of crude death rate would be much higher there, as opposed to, I looked this up, but it was like Utah is a very young state, and so their crude death rate would be lower, so they adjust that statistically so you're comparing apples to apples.
Okay.
In terms of age distribution. So that's the benefit of the age-adjusted mortality rates is you can compare town to town and town to state and know that you're, comparing apples to apples. So anyway, I saw this as positive news. I thought I would share it. And then I think I have the one last thing to take, which I thought you would all appreciate, is there's a brand new Journal of American Medicine article out about caffeine intake and dementia risk and cognitive function, and basically the meaning of this is that higher caffeine coffee intake was associated with more favorable cognitive outcomes. So it's supportive of many of our coffee habits. But this came out today, which came across my desk, so I thought, that's interesting. So now maybe I can go back to having a cup of coffee in the afternoon, to improve my cognitive function. So, but that is my report. I'm gladly to take any questions you have.
Any questions for Sam?
I do not.
Great report. Thanks so much.
Thank
very
you.
much, Sam.
Any communications from anyone?
I have none.
I have none.
Same. Any old business?
We have none.
Any new business?
None.
Do I have a motion to adjourn?
Motion to adjourn.
So moved. I heard a second in the background there, sure.
Okay.
Yeah, any opposed?
That was,
Hearing none,
Sophia seconded that, yeah?
Sure, yeah.
Yeah, sure.
And we are adjourned at 8:01.
Okay, thank you, everyone.
Yeah.
Thanks, everyone.
Thank you.